The Inland Empire Health Plan and Healthy Heart Nation have partnered for this series to discuss the importance of heart health in the African American community. Leading this conversation is Kenita Bourne, a licensed clinical social worker and the manager of social and community services at IEHP, and Dr. Columbus Batiste, a board-certified interventional cardiologist. Let's join this conversation where we will dive deep into crucial topics and provide you actionable tips to help you and your loved ones live heart-healthy lives.
Okay, Doc. So it's inevitable that sometimes people get sick.
Yes.
And when you get sick, you go to your local pharmacy and you grab some over-the-counter medications to take care of whatever your condition is. Are there medications that I might take for a common cold that have an effect on my blood pressure if I have high blood pressure?
Yeah, no, that's a great question because there's so much out there. There's Dr. Google out there, and people go to the store and they say, I'm going to treat this with whatever. And so I think one of the values of going and seeing a provider is that they're looking, hopefully, at your entire history to find out the right blend of medications that suits you. And so what we find is that when you go into the store and you're going to check, I have hay fever or my upper respiratory infection or I have a cold, and you start taking some of these over-the-counter cold medications, they actually can raise your blood pressure. They can raise your blood pressure, and some of them actually can increase the heart beating a bit fast, or we call palpitations or skip beats and things. And so it becomes extremely important to really read the labels and check with your doc first if you have high blood pressure to know, is this something that I can take or is this something I should stay away from? And so what I've seen many times is people will ingest these medications on a regular basis for sinus medications, and they're taking cold and flu medications, and these things are raising the blood pressure and causing a major issue.
Wow.
Yeah.
I mean, is there anything specific that we should be looking for in the labels, or is it more of the conversation with our doctor to tell us what to look for?
You know, there are lots of specifics. I always like to tell everyone, have a conversation with your doc, you know, in terms of finding out a list. And so when you go in to see your doc, say, hey, you know what? Is there anything that I should stay clear of? Because understanding the balance between your condition as an individual and what's there, that will help give guidance. But there are warnings on many of the products now about if you have high blood pressure, don't take this or talk to your doctor first. Don't ignore those.
Oh, those are not suggestions?
No, well, and now I'm gonna tell you, the first thing you have to do is you actually have to read the label. So we have to make sure we take a little time and spend time and actually read those labels. And if we're unsure, that's when we have to ask those questions.
And this goes for painkillers too?
Definitely for painkillers as well. So some of the painkillers, the anti-inflammatories, can also raise the blood pressure. So we have to be aware of those things. And so it's a balance. That's why I say talking with your doctor, because if you're in intractable pain, your doctor may say, well, you know what? I think the pain is causing the high blood pressure. I'd rather you take the medication. And so there's a lot of different caveats that come into play for you as an individual. But in general terms, don't just go popping pills without knowing what its effect is on your body.
Don't pop pills.
That's right.
Without question. Got it.
That's
Got it,
right.
Doc. Thank you.